out here in the 10 acre that's not feeling too well. So Dr. Gina is going to come up here and they're going to take a look at him, but we're not sure. Maybe colic, we're not sure. Dr. Gina is going to pass a tube rectally and give him rectal fluids. He is a little bit dehydrated, so that'll help kind of perk him up. We're going to have to do further diagnostics, but for now we're giving him lots of cuddles and he's doing very good for his treatments.
Yeah, that same material isn't really going anywhere.
Have you been eating rocks?
Do you have masses? There's like a little loop of duodenum right there. And it's hypermodal. So something between duodenum, or sorry, jejunum. The small intestine that plops in right there. I guess it's over there now. And that's hypermodal.
I'm going to attempt to do an abdominocentesis, which is a abdominal tap, to see if he's got changes in his peritoneal fluid. If there is an increase in total protein, if there is an increase in other type of cells, or if there is a change in the color, that could all tell me different things about what's going on internally. If you tap it and you find fecal material in that peritoneal fluid, then we know he has a rupture, and that's automatic game over. Once that happens in horses, it's bad news bears. I don't think we're that advanced yet, but I would like to just see what's going on internally with that. It's just another diagnostic tool to see how his GI is responding inside of his abdomen. At first, when I first saw him this morning, sometimes when we say horses are colicking, that just usually means they have pain in their abdomen somewhere. A lot of people automatically think it means there's a GI problem, but sometimes if they have like a urinary calculi or bladder stone, something like that can cause colic pain. If they have something respiratory-wise that can cause colic pain, it can be referred from somewhere else. So I wasn't exactly just jumping to that he had like an impaction or anything, because he was passing feces up in quarantine. Once I put my hand up into his rectum and felt that I couldn't pass it any further, and also usually the rectum is a straight in, and his was deviated to the left, and usually that means that there is a impaction deviating the colon off to the side. So I think he's got an impaction colic in his colon. We put some fluids via his rectum to hopefully break up that really hard fecal material so he can hopefully pass it. He's passed some, but his rectum was really irritated, so I didn't want to keep putting my hand in there. Hopefully everything will calm down and I can recheck it. Also on ultrasound, we found hypermotility in some areas, and then we found like no motility at all. So GI stasis, which is a poor prognostic indicator. So hopefully we can get his GI moving and everything, but I just want to make sure everything is looking good in his peritoneal fluid. Yeah. Thank you. It's kind of cloudy. Sorry, buddy. Try not to put it too far in because I don't want to actually get intestines. There you go.
I also have an EDT if you want.
That is beautiful.
Okay. All right, buddy. Good job. Very good boy. As soon as we shaved it. This is some of the drops that came out of his abdominocentesis tap that happened to come onto my glove, and there's just like little flecks of stuff that looks kind of like abdominal content or GI contents. So that's not looking great. It does appear that there are small flecks of abdominal content or of GI contents in the fluid sample that we took. There is a chance that If the GI is really distended, that even if you go in just barely a little bit, you could actually end up doing an enterocentesis into the GI tract as opposed to just an abdominocentesis. So that is a chance that we got ingesta from his GI tract instead of a true sample from his abdominal cavity. We could give him some antibiotics and recheck him in a little bit and see if he still is able to have his pain managed, or if he's not able to be managed, then he would be a surgical candidate, and that is a surgery that we don't do here. He'd have to go to a referral hospital, and that even going through colic surgery, there are a lot of poor prognostic indicators that happen, and the recovery is rough, and some horses don't even make it through the recovery. So that would be something we'd have to talk about as a team if we think he would be a good candidate for that, and if it's something that we could do for him.
More liquid. Oh, it's like right there on me. Oh, it's so dry. He's straining very hard. You're doing it. It's a boy. Good job, buddy.
We'll see if he'll let me put this hand up his bum again.
Want me to try again, big guy? Sorry, I know your butt's probably like so painful. All right, let me get it back in place. What is that? Is that just your intestines folding over on themselves? There's like a lump, a soft tissuey lump I can feel to the left.
Just where it's solid. It's weird.
Yeah. You need to come out of there, girl. There you go. All right, let's see what you do. If you want to pace around and get that poop out, that would be fantastic. So we just put Red out in his stall just to see what he would do. Hopefully that he would walk around and hopefully help some of that GI stimulation happen. He urinated immediately and then started eating some hay, so that helps me know that he's at least comfortable enough to be interested in going and eating and not just laying down. So we're going to leave him in the stall overnight. Hopefully he'll be perky bright in the morning. We gave him some IV fluids. We gave him 2 rounds of rectal fluids. We did the abdominocentesis, but there is a chance that it was an enterocentesis instead, because he doesn't clinically look like a horse that had a ruptured GI. So his blood work looked pretty okay. Nothing super alarming about it. His heart rate is staying in the 40s. Other than that, he just looks physically uncomfortable and he's trying to go to the bathroom. So hopefully that extra dose of fluids will help break that up and help him get it out. But movement is really good. So that helps stimulate GI movement. So we're hoping in the morning we'll see a nice, bright, bubbly red. So hopefully he'll pass and he'll be fine. So for a follow-up on Red's case, after we gave him oral and rectal fluids and some pain management that was a little bit stronger than just the initial xylazine, he did end up passing his impaction, and he had several good piles of fecal material in his stall. So we had cleared the impaction, which was great, but there were still some changes from intake on radiographs that when we were discussing him with his colic episode, we also revisited his radiographs and his limited mobility in his cervical spine. So he can't bend his head side to side like he should. He just kind of like cranes like this. And he's also really neurologic in the hind. So he kind of keeps his legs way out and he sways when he walks. So discussing all of that and his colic episode, unfortunately, upper management and the vet team kind of came to the conclusion that he was really painful, and the changes on his radiographs were true, because sometimes when you're looking at them in the field, you're worried that it might just be like something you're seeing, and when you get it into the the equipment in here and look at it on the computer, it looks different, but it was the same, and you could see it on both views. So he had some true pathologic changes in his cranial cervical spine and his skull, his caudal skull. So given those signs and then how off he was in the hind, the last act of kindness was decided for him, unfortunately, even though we got him through his impaction colic episode. But going into the winter and worrying about horses colicking over and over again and things like that, and that he was so painful, even with just, I mean, it was a pretty big impaction, but it wasn't so significant that it was like causing a volvulus or any kind of thing like that. But he was just really hard to manage his pain with that. So given how painful his neck is, we were really worried about him. So it's not the update I was hoping to give, but yeah, the last act of kindness was what was decided.